Life is complex, so is our mental health. It cannot be understood by diagnosis alone. Our philosophy is treat the person, not the mental illness.
Prior to using this hypnotic script, it is very important for you to know that you should not be doing this while driving a vehicle or anything else that requires you to be awake and alert, as this could be very dangerous. Be in a place in which you can just fully let go, relax, and participate in that full hypnotic experience. Hello, I'd like to talk to you for a time. I hope that you'll be able to listen to some important things that I have to tell you. Some important things that could bring you to a place in which today you begin to reduce and potentially over time even completely remove the pain that you have experienced and are experiencing. In order to do that, I need you to be able to understand some important things that perhaps you don't already know about pain in general, and also to be able to understand some things about your pain specifically. Now, one of the things about pain that people don't actually realize or understand is that pain is a boundary. Pain is for protection. Pain is your body's signal to you that something is wrong. And it's your body's signal to you to say you need to take care of something. It's an alarm telling you that you have been damaged and that damage needs care, that you need to take care of yourself. And so one of the mistakes that people make is they ignore their pain. And they try to pretend that their pain isn't there, or that somehow they can accomplish whatever they want to despite their pain. That will not work. And it's important for you to understand that. The other thing that people don't know about pain, or often don't realize, and that is that the pain receptors inside your nervous system, those pain receptors, they're the same, regardless of whether this is a physical cause to your pain. That is, if I was chopping up vegetables and I cut my finger, or if it is an emotional cause of your pain. That is, somebody betrayed me. Somebody hurt me. You see, all pain is physical. Because inside your nervous system, your nerves don't touch. They send messages to each other through bioelectrical energy. And that energy that moves between those nerves comes through biochemicals. You may have heard of serotonin, dopamine, norepinephrine, these different chemicals that flow in your body. And whether you have somebody that has said or done something to you that hurt, or whether you cut your finger while slicing vegetables, that chemical process is the same. It's very important to understand that pain is trying to send you a message. In fact, I don't know if you ever remember a time in your life when you have been hurt. Say you cut your finger, but you didn't even realize it. You're just like, something is slippery on my hand. What is that? And then you look, and you see that you're bleeding, and then all of a sudden there's shock, maybe even panic, because you don't know about how badly you're hurt, and it's a strange thing to experience. Why didn't I know I was hurt? And those emotions flow, and the pain starts. So one of the things to understand is that pain is associated with trauma. And that example of when you didn't realize you were cut, and it only started to hurt when you realized you were cut and you could see it, is really understanding that trauma is not what happened to you. If the trauma was what happened to you, then as soon as you were cut, you would have known you were cut and you would have felt the pain. Trauma is what happened inside you, in those neural connections that I'm talking about, in the emotions, in the feelings that are associated with those events. And so at times people heal and the pain goes away. And that's possible, and it's possible for you now. And so this is the part in which you start to understand that there's some specific things about your pain that maybe you don't realize, maybe you don't know. And what we're going to do today is we're going to help for you to be able to allow that pain to teach you the lesson or whatever message it has for you, so that you can accept it and so that you can let it go. Because you can. You can let it go. And so what we're going to do is we're going to get you into a deep state of relaxation. And then we're going to lead you through a journey to help you to find that inner healing. So I want you to take a nice, deep breath. Close your eyes and begin to relax. Just think about relaxing every muscle in your body. From the top of your head to the tips of your toes. Just begin to relax and begin to notice how very comfortable your body is beginning to feel. You are supported, so you can just let go and relax. Inhale and exhale. Notice your breathing. Notice the rhythm of your breathing and relax your breathing for a moment. Be aware of the normal sounds that are around you. These sounds are unimportant. Discard them. Whatever you hear from now on will only help you to relax. And as you exhale, release any tension, any stress from any part of your body, mind, and thought. Just let that go. Just let any stressful thoughts rushing through your mind, feel them begin to wind down, and relax. And begin with all of the muscles in your face. Let them relax, especially your jaw. Let your teeth part just a little bit and relax this area. This is a place where tension and stress gather. So be sure and relax your jaw and feel that relaxation go into your temples, and relax the muscles in your temples. And as you think about relaxing those muscles, they will relax. Feel them relax. And as you relax, you'll be able to just drift and float into a deeper and deeper level of total relaxation. You will continue to relax. And now let all of the muscles in your forehead relax. Feel those muscles smooth, smooth, and relax. And rest your eyes. Just imagine your eyelids feeling so comfortable. So comfortable. So heavy. So heavy. So relaxed. And now let all of the muscles in the back of your neck and shoulders relax. Feel a heavy, heavy weight being lifted off your shoulders, and you feel relieved, lighter, and more relaxed. And feel that soothing relaxation go down your back, down, down, down to the lower part of your back, and those muscles let go. With every breath you inhale, you feel your body drifting and floating down deeper, down deeper, down deeper into total relaxation. Let your muscles go, relaxing more and more. Let all of the muscles in your shoulders running down your arms to your fingertips relax. And let your arms feel so heavy, so heavy, so heavy, so comfortable, so relaxed. You may have tingling in your fingertips, and that's perfectly fine. You may have warmth in the palms of your hands, and that's fine. You may feel that you can barely lift your arms. They are so relaxed. They are so heavy, so heavy, so relaxed. And now you have them feel, and everything feels so heavy and relaxed. And you inhale once again and relax your chest muscles. And as you exhale, you feel your stomach muscles relax. As you exhale, you relax all the muscles in your stomach. Let them go. And all of the muscles in your legs, feel them relax. All of the muscles in your legs, so completely relaxed, right down to the tips of your toes. Notice how very comfortable your body feels, just drifting and floating deeper, 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 relaxed. And as you are relaxing deeper and deeper, imagine a beautiful staircase, and you are at the top. There are 10 steps. And the steps lead you down into a corridor. In a moment, you can begin to imagine taking a safe and gentle and easy step down on the staircase, leading you into this corridor. You can imagine and you can see yourself and feel yourself being able to step down the staircase. So in a moment, I'm going to count backwards from 10 to 1. And you can imagine taking the steps down, one step for each number that I count. And you'll be able to feel your body relax more and more for each step that you take down the staircase. Just drifting down with each step. And you'll be able to relax even deeper. 10. Relax even deeper. 9. More and more relaxed. 8. Just drifting and floating, drifting and floating. 7. 6. 5. Deeper and deeper. 4. 3. 2. And 1. Deeper and deeper relaxed. And now you imagine that you are in this corridor, and it's lined with doors on either side. Behind one of these doors is a very safe space, a safe place that is only yours. A place where there is nothing to bother you, nothing to disturb. It is the most peaceful place in the world for you. And you'll be able to imagine yourself there. And this will be a place in which there is healing for you. This is a place in which you're going to experience something that will allow you to be able to connect to the messages that pain has been trying to send you, so that you can hear what those actual messages are, so that you'll be able to actually incorporate those messages. You'll be able to let it go. In fact, you'll also be able to give that pain important messages that you have for that pain that you have been experiencing. So I want you to take some easy steps. You are unhurried. And so you can take your time as you stroll down through the corridor. And you come to your door. And I want you to notice your door. As you try to open it, it is locked. But you notice that there is a weight in your pocket. And that's because you and only you have a key. So take the key out of your pocket, open the door, and step into this place. Make sure as you do so that you lock the door behind you. And then as you step into this place, I want you to really notice where you are. It may be somewhere that you have been. Potentially it is somewhere that you've never been. I don't know. And it really doesn't matter. All that matters is that it is connecting for you. Notice where you are. Get in touch with it. It may be outside. It may be a place that's actually inside, somewhere that you felt safe. Wherever you are, explore it with all of your senses. Notice the smells, what you can see, what you can hear, what you can physically feel. Really get in touch with this place. Really notice how safe that you can be, because this safety is going to be very important. This safety is going to allow you to be able to address, integrate, understand what has been happening for you in the pain that you've experienced. Now, there's an object that is in this place. This object is a very special mirror. This mirror is going to allow you to communicate directly with your unconscious or subconscious self. And this unconscious or subconscious self are answers. Answers that are connected to and associated with your pain. And because you feel safe, because you're so relaxed, you can allow yourself to have an authentic conversation with yourself. And you can allow the barriers and the blocks to fall away. Fall away. So that you are able to have this authentic conversation that will allow you to understand the message that your pain has been trying to give you. So I want you to approach the mirror. And I want you to be able to look into this mirror. I want you to take a moment to ask the question that is to be able to ask, what is the reason? What is the purpose? What is the message that you have been trying to give me? What are you trying to protect me from? And I want you to take a moment just to look into the mirror. Take a moment to listen. Take a moment to hear. What that unconscious or subconscious self has to say. I want you to really listen, really consider what it is that it's trying to tell you. And then I want you to say to this part of yourself, I want you to say, thank you for trying to protect me. I hear you. All this time you were trying to protect me. And I hear your message. I'll listen to you now. You don't need to protect me anymore. Because what happened to me is over. It's not happening anymore. And the muscles that are in my jaw, and the muscles that are in my neck, and the muscles that are in my shoulders, and the tendons and the ligaments, all through my arms, down through my fingers, and the muscles that are in my chest, and the muscles that are in my stomach, my back, and all those tendons and ligaments and all the connective tissues in my bones and my nerves, and all the muscles that are in my stomach, and all the muscles that are in my hips, running through down to my legs, all the way down to my feet. They can let go. Because what happened to me is over. And the injury is over. And because that injury is over, I can let go. And I can allow myself to be whole. The pain was trying to tell me to be compassionate to myself. The pain was trying to tell me that I was past my limits, or that something was wrong. And I've heard that message. I don't need that message anymore. And in the future, I will listen. If pain comes, I will know it's not something to fear or something to try to get rid of, but rather that it's something that's trying to tell me to be compassionate to myself. And I will give that compassion to myself, the same compassion that I offer other people. I want you to feel, notice how your body is changing, because it is changing. Scan yourself. Start at the top of your head. Notice how your muscles have released and they've let go. Notice how your forehead has become smooth. And that warm, smooth feeling has run down your forehead, through your jaw, through your mouth, and into your neck. And down through your neck, into your shoulders. Down through your arms, and also flowing down through your chest and your back. Your stomach. And down through your hips, down into your lower body. Down through your legs, all the way down to your feet. You feel like you can fully accept yourself. And be compassionate to yourself. And you're going to take this healing and it's going to stay with you. It's going to stay with you for the rest of the day, through the evening. And it's going to stay with you tomorrow and the day after that, and the weeks after that, and the months after that. And any time that you notice that you're feeling really in some kind of pain or distress, you'll be able to understand that your body is trying to tell you something. And you'll be able to accept that message much more quickly and much more easily. And you'll be able to step in front of a mirror. And you'll be able to look into that mirror. And you'll be able to have a conversation with yourself. And you'll be able to speak with the same kind of compassion, understanding that you would have for a good friend. Now I want you to step back away from the mirror, and I want you to really pay attention once again to where you are. And reconnect with that sense of safety. With all of your senses, notice where you are. And I want you to just enjoy this special place for another moment. And then I want you to walk back towards the door. And as you come through the door, once again, I want you to close the door and lock it, because only you have access to this space. And then I want you to start to walk back towards the staircase. And as you start to walk back towards the staircase, you'll notice one of the doors in the corridor is ajar. It's open. I want you to approach that door. You'll notice actually that you've been carrying something with you that you no longer need. I want you to use curiosity to understand what this is. What is it that I've been carrying with me that I don't need anymore? And then I want you to take that, whatever it is. I want you to throw it into the room that the door has been ajar. And I want you to close the door. You're going to leave it there because you don't need this anymore. And then I want you to walk back towards the staircase. And I will begin to count from 1 to 10. And as I count from 1 to 10, you'll take a step up the staircase. And as you take a step up the staircase, you're going to begin to come back into full awareness and full consciousness. You will come back feeling refreshed, as if you had a long rest. Come back feeling alert and relaxed. I want you to begin to come back now. 1, 2, coming up. 3, becoming more awake, more alert. 4, 5, reconnecting with the physical environment you're in, feeling the chair or the couch behind your back. 6, more and more alert. 7, 8, 9, beginning to open your eyes, and 10, opening your eyes and coming all the way back to feeling fully awake, fully alert, feeling great. Thank you for joining us today. We hope that this message has been as meaningful to you as it has been to us. If you're looking for help, you can find us on Facebook at Humanizing Mental Health.